Our study is entitled Impact of Delayed Diagnosis on Overall Survival and Disease-Free Survival in Medullary Thyroid Cancer. So this study was performed to evaluate the survival rates of patients with medullary thyroid cancer and explore how diagnostic delay for previously identified thyroid nodules, later confirmed as medullary thyroid cancer, affect outcomes, highlighting the importance of calcitonin measurement in the screening process. This is a retrospective multi-center cohort study conducted in Argentina from March 1, 2009 to March 1, 2024, included patients with a histological diagnosis of medullary thyroid cancer. From diagnosis was defined as a diagnosis of medullary thyroid cancer in less than 18 months after the diagnosis of a thyroid nodule, and delayed diagnosis larger or equal than 18 months. Overall survival and disease-free survival were compared between delayed diagnosis and prompt diagnosis. We included 159 patients with a mean age of 51 years old. Pre-surgical calcitonin levels were measured in 91% of these patients, and patients with delayed diagnosis were older with significantly higher calcitonin and CA levels. Patients with delayed diagnosis had the larger nodules, more than one pathological risk factor, and 29% of them were diagnosed with a DNM stage 4C. Median follow-up was 70 months. At the end of follow-up, 17% of these patients had died from the disease, 10% had biochemical persistence, and 11% had structural persistence. The remaining 62% were disease-free. Logistic regression showed that having a delayed diagnosis and the increased nodule size on ultrasound were significant predictors for both mortality and recurrence. Delayed diagnosis had an odds ratio of 2.9 for recurrence and perfect collinearity for mortality. Tumor size had an odds ratio of 1.1 for mortality and 1.2 for recurrence, with a statistically significant difference. Disease-free survival at 60 months was 64% in delayed diagnosis versus 90% in the prompt diagnosis group, with a statistical significant difference. So our study highlights the critical impact of delayed diagnosis in medullary thyroid cancer on both mortality and recurrence. And despite the fact that patients seek timely consultation and undergo ultrasound and fine needle aspiration cytology, the low diagnostic performance of this methodology for detecting medullary thyroid cancer usually leads to delayed diagnosis. Patients with delayed diagnosis represent or can present with larger nodules, higher calcitonin and CA levels, and more advanced disease, including lymph node metastases.